Governments around the world are currently implementing various measures to prevent the spread of the 2019 novel coronavirus, COVID-19. Japan has kept the number of infections and the number of deaths comparatively low, and its measures have received recognition worldwide. Rather than completely containing COVID-19, Japan's goal has been to minimize the number of serious cases and deaths by slowing the pace of the infection and enhancing the healthcare system. Based on the Japanese legal system, administrative leadership, and chains of command, Japan has responded to the risk of COVID-19 infection through governance of organizations, infrastructures, available manpower, resources, and materials. Here, we will introduce some of the features of the Japanese response, as well as a variety of JICA's international initiatives to prevent the spread of infection. First, let's look at health administration in Japan. Japan established a national health insurance system in 1961, along with improved access to healthcare. The early achievement of universal health coverage, where no one is left behind, has led to Japan having one of the longest healthy life expectancies in the world. The goal of Japan's health administration has been to maintain and promote the health of all Japanese citizens. The national and local governments have organized activities to prevent disease and promote health under their public responsibility. Here, we will look at the national health insurance system, the cornerstone of Japanese health administration, and public health centers, which manage infection risks in communities. One common form of health administration is the national health insurance system. In Japan, all citizens enroll in some form of public health insurance. The system is a free access system that allows patients with a health insurance card to choose their own medical facility and visit it whenever they need to. The cost of medical care is the same nationwide at an official price, and those between the ages of 6 and 69 pay 30% of the total cost of medical care. There is also a high-cost medical care reimbursement system, which sets an upper limit on the burden of monthly medical costs. Private medical facilities account for 70% of Japanese hospitals and more than 50% of hospital beds. Japan is unique in that the healthcare system comprises mainly private institutions. Prefectures and cities set up public health centers based on the Regional Public Health Act. About 470 public health centers nationwide conduct wide area and specialized public health activities, including infection prevention and control.
保健所はもう公衆衛生全般を担う行政機関なんですけれども、今は感染症が注目されていますが、その他に母子保健ですとか、健康づくりとか、あと精神保健対策ですね、こういった対人保健に関わるところ全般と、あと対物保健といって、食品衛生ですとか動物愛護、そして環境対策などですね、多岐にわたっております。そしてまた保健所はですね、医療についての対策をするところでもありますので、地域医療についての救急医療体制を作るですとか、いろんなですね、医療機関の役割分担についての会議を行うですとか、そういったいろんな役割を担っているところです。
In infection-related operations, after an infection has been confirmed, public health center staff conduct surveys for infection prevention and control in the community. They play an important role in establishing measures to prevent the spread of the infection, based on information obtained from these surveys. In this way, public health centers are on the front lines of COVID-19 response. Now let's look at the role that public health centers play in specific COVID-19 measures. Public health centers handle epidemiological surveys and coordinate examinations and hospitalizations.
昨日最終的に12件陽性者が出ています。で今日の割り振りです。病院の方に検体回収、あと疫学調査ですね。1人昨日ちょっと体調不良で聞けてない人がいるので、その方の分の疫学調査をお願いします。
今からはですね、新型コロナウイルスのクラスターが出た施設に行ってちょっと、検体を取るのと、あと施設の中の確認をして指導とかを行います。
The Public Health Centre checks the status and source of the patient's infection and investigates contacts before and after the infection was discovered. Then it conducts PCR tests to identify any new infections. By tracking close contacts, it is possible to deduce the source of the infection, get an overview, and quickly prevent further spread.
非常に重要なのがやはり丁寧にお話を聞くというところになりまして、でその行動の一つ一つについても、どれくらいの時期その場に滞在したのか、そしてその場に滞在した時に何をしていたのか、ご飯を食べていたのか、じっと本を読んでいただけなのか、もしくはもうご飯をワイワイ食べながら席を移動しながらだったのか、そういったかなり細かな点までですね聞くようにしています。
When the Public Health Centre identifies someone as a close contact, they are asked to self-isolate for 14 days from the date of contact with the infected person. During that time, the Public Health Centre provides health checks, and if the person is symptomatic, PCR tests are conducted to quickly discover infections and prevent further spread. The Public Health Centres established call centres for Japanese returnees and potential contacts to provide information on COVID-19 infections and prevention measures and respond when someone has worrying symptoms. This was to prevent secondary infections and breakdowns in medical care when many infected persons arrived at hospitals all at once. If someone had a fever or respiratory symptoms, they were asked to contact the Public Health Centre before consulting at a medical facility. When the Public Health Centre determined that this person might be infected through a telephone consultation, it arranged a consultation at an outpatient clinic for returnees or contacts. In communities that lack medical facilities for outpatients, the Public Health Centre sometimes collected the specimens on their behalf. In many local governments, the Public Health Centres played a central role in coordinating hospitalizations and recovery facilities if the tests came out positive. Based on a medical judgment in an outpatient setting at a medical institution, patients with serious or moderate symptoms were hospitalized, while patients with mild or no symptoms recovered in a residential treatment and recovery facility. In some cases, the patients recovered at home. The Public Health Centres arranged transportation for medical consultations. Another important role of the Public Health Centres is to create structures for collaborations between medical facilities and other related organisations in the area.
公衆衛生とかこういった何かしらの対策っていうのはもう一人ではできないものなので、やはり仲間を作るっていうのは非常に重要だと思うんですね。で、私たちももちろん保健所としての一つの機能ではありますが、いろんな仲間ですね、協力してくださる先を探していろんなことを仕事を増やしていく、うまく回していくというところなので。
Here, we will look for hints on how to prevent the spread of infection by focusing on what messages the Japanese government sent to the public and how the Japanese people acted in response to the unknown infection. The Japanese government decided to handle COVID-19 as a designated infectious disease equivalent to a Category 2 infection. As the infection spread, the Japanese government declared a state of emergency in prefectures across Japan. Citizens were asked to stay at home except for urgent business. Commercial facilities and companies were asked to shorten their hours or close, and the healthcare system was improved to provide better service. In Japan, however, the state of emergency was not enforced. It was merely a request to cooperate by restricting activities. This required efforts to change people's behaviour. A meeting of government specialists recommended careful attention to hand washing and coughing etiquette and asked that people stay home from work or school if they didn't feel well. They also encouraged people to avoid 1. Closed spaces with poor ventilation, 2. Crowded places, and 3. Close contact settings, all areas with heightened infection risk, which they referred to as the 3 Cs. The 3 Cs was used everywhere as a key word to promote a change in people's behaviour. The Japanese for 3 Cs, Sanmitsu, was used frequently at press conferences held by the national and local governments, and many posters and leaflets were created urging people to avoid them. The effectiveness of avoiding the 3 Cs was recognized by the WHO and gained worldwide recognition. The Ministry of Health, Labour and Welfare published 10 tips for reducing contact by 80%. It provided a simple explanation of how to behave and asked for citizens' understanding and cooperation. Thus, Japan's countermeasures were focused on stopping the spread of the disease to the community through early detection of infection, trusting in people's sense of hygiene, discipline, and morality. Japanese socio-cultural practices regarding hygiene have gained attention overseas. Despite the legal restrictions preventing enforced lockdowns of entire cities, Japan was able to keep infections relatively low. Let's see what actions were taken to prevent the spread of infection. Most Japanese people take their shoes off when they get home. They wash their hands, gargle, and change into house clothes. Most Japanese people take a bath or shower every day. In addition, Japanese people rarely kiss or hug in public, which is a common greeting in many countries. In addition, the Japanese wear masks not only to prevent COVID-19 infection, but also when they catch a cold or have a cough. They are concerned about passing their cold on to others. After the spread of COVID-19 in Japan, more than 80% of the Japanese started disinfecting their hands and fingers with alcohol. These prevention measures were already entrenched as everyday habits for Japanese people, even before the COVID-19 pandemic. These habits are directly in line with the measures announced by the WHO to prevent the spread of the infection. It is believed that the factors of hygiene, discipline, and morals have had a significant impact on the low number of infections and deaths in Japan compared to other countries. Although the national government presented general policies regarding prevention and treatment, conditions on the front line differ depending on the prefecture. The most important aspect of infection countermeasures is collaboration among prefectures, regional referral hospitals in each prefecture, and public health centres in the field. Here, we will look at the example of Nagasaki Prefecture. Nagasaki Prefecture is located on the westernmost tip of Japan in western Kyushu. It comprises many large and small islands, including Goto, Iki, and Tsushima, and several peninsulas, including Nagasaki, Nishisonogi, and Shimabara. It has a total area of 4,131 square kilometers. The prefecture has a total population of about 1.3 million, with a growing senior population, as seniors aged 65 and over account for more than 30%. Nagasaki has a long history with Western medicine. JLC Pompey, a Dutch Navy doctor, opened a medical school and hospital in Nagasaki in 1857. This is the predecessor of the current Nagasaki University School of Medicine. Facing the ocean, it established a tradition as the gateway to Western medicine. Nagasaki Prefecture gathered the medical resources of the prefectural and city public health centres, the Prefectural Medical Association, and the Nagasaki University Hospital to create a system that took advantage of its unique characteristics to deal with COVID-19. Let's look at the three main elements of this structure: prevention, precaution, and treatment. Here, we will introduce the system improvements put in place by Nagasaki Prefecture and Nagasaki University Hospital before the spread of the infection and the message communicated to prefectural residents. Nagasaki Prefecture established a COVID-19 response headquarters based on an amendment to the Act on Special Measures for Pandemic Influenza and New Infectious Diseases, Preparedness and Response to include the new virus. The prefecture website also posted information on hand washing and using masks and called on residents to take caution. When the state of emergency was declared nationwide, Nagasaki Prefecture requested that all residents avoid going out unless absolutely necessary. A Prefectural Pandemic Influenza and New Infectious Diseases Preparedness and Response Council Medical Subcommittee created a 5-stage plan for securing hospital beds based on the status of the infection, and the prefecture requested that medical facilities secure beds as required. It also designated key medical facilities to accept patients with moderate symptoms and selected medical facilities for serious patients. To prevent cluster outbreaks, public health centre staff visited psychiatric hospitals and social welfare facilities with many residents to provide guidance on preventing infections and confirm initial responses when outbreaks were identified. Nagasaki University held public lectures to explain the characteristics of COVID-19 infections and prevention measures. It called on residents to wash their hands carefully from fingertip to wrist, wear masks in crowds, gargle, and practice coughing etiquette. Here, we will introduce Nagasaki Prefecture's unique testing system. In Nagasaki Prefecture, the Nagasaki Ken Medical Association, Nagasaki University, Nagasaki University Hospital, and family doctors in the community initiated PCR tests for COVID-19 using saliva. Even if the patient had no fever or respiratory symptoms that might suggest COVID-19 infection, they could still undergo testing if they felt sick or otherwise suspected infection.
我々は早い段階から唾液による検査、これをやりたいということを積極的に進めておりました。当初は鼻咽腔からの採取による PCR 検査だったんですけど、鼻腔からだとどうしても飛沫感染が防げない。7月の中旬にはもう国が認可しました、唾液による検査をね。それに伴って8月初めには長崎大学の中央検査部と話をしまして、かかりつけ医でその検査ができるようにということで契約を結びましたね。
In preparation for the spread of the pandemic, with the assistance of city and municipal medical associations, 3 drive-through testing centres were established in Nagasaki City, Central Nagasaki Prefecture and Sasebo, where visitors could give specimens while still in their cars. On remote islands, which are a unique geographical feature of Nagasaki, many communities lack doctors, medical facilities and testing facilities. A system was put in place so that even on remote islands, residents could be tested quickly by visiting a central hospital in the community. To enable this, the time required to detect the COVID-19 gene was dramatically reduced by introducing a testing device that applies fluorescent loop-mediated isothermal amplification developed by the Institute of Tropical Medicine at Nagasaki University.
実際 PCR の機械というのがこちらの機械なんですね。これでずっと検査をしていて、だいたい検査時間も2、3時間かかるものなんですけれども、今回、経口ナンプ法はこの機械を使うんですけれども、非常に軽い 1.7 キロぐらいですね。でしかもこれ、バッテリー内蔵なので、こういうふうに外しても3時間ぐらいは 動かすことができます。で、非常に迅速なので、10分以内にだいたい新型コロナウイルスの遺伝子でも検出することができるという機械になっています。
Nagasaki Prefecture, Nagasaki University Hospital, and other designated medical facilities have secured beds and devised infection control measures to ensure that residents can receive safe, reliable healthcare. The prefecture also provided mental health care for healthcare workers who were treating patients infected with COVID-19. Next, we will look at some of these activities in more detail. Thorough implementation of standard precautions is extremely important in preventing COVID-19 infections. According to the WHO, healthcare workers who come in contact with or provide care to patients infected with COVID-19 are at a higher risk of infection than the general public. So the specified policy is to select and wear PPE or personal protective equipment as required in treatment situations, and to practice hand hygiene and universal masking in healthcare facilities. Nagasaki University Hospital held a special nosocomial infection control seminar for all employees to ensure thorough hand disinfection. Outpatients receive temperature checks at the hospital entrance, and patients with symptoms are required to wear a mask and are led to a dedicated waiting area. The hospital buildings are separated into red and green zones as infected and non-infected areas. With the prolonged outbreak of COVID-19, securing healthcare workers has become a major issue nationwide. There were no resignations from Nagasaki University Hospital, but in August, the hospital conducted an employee survey on whether they had been subject to abuse related to COVID-19. The results showed that about 20% of respondents experienced being avoided or receiving requests to have their children stay home from school or daycare.
この感染症誰しもがなる可能性があって、皆さん好きでなるわけではないというところがありますから、やっぱり思いやり持ってほしいなっていうことは毎回お伝えはしてるところですね。で、ただそこにはですね、実はあんまりいろんな情報を公開されなかった側面ももしかしたらあるのかもしれません。
Thus, Nagasaki University Hospital and other infectious disease responsive medical facilities, the prefectural government, the city, the medical association, public health centres and related organisations worked flexibly together to prevent the collapse of medical care.
やはりもう公衆衛生というのは全ての人が対象なんですね。だから健康な人も病気になった人も特定の人だけが対象ではなくて全ての人が対象になりますので、そういった意味ではですね、やはりいろんな、大学、医師会、いろんなところとの協力連携というのはもう欠かせないものだと思っています。
私自身はすごく大きく考え方が変わって、どの病院もコロナの患者さんを受け入れますよというふうな体制を作らないといけないんだろうなと思いました。普通にインフルエンザを見るのと同じように対応していけるような、全部の医療機関でコロナ対応できるような仕組みを早急に作り直さないといけないと思います。
Countless people throughout the world are suffering from infectious diseases, not just COVID-19, and emerging and re-emerging infectious diseases pose a threat to human security. There is a growing international awareness of the importance of strengthening responses to public health risks in Africa in particular. Nagasaki University has been a driving force behind infectious disease research in Japan and has trained specialists and dispatched them to other areas in Japan and overseas. The Institute of Tropical Medicine at Nagasaki University has been working to suppress tropical diseases through leading research and by applying research results in the fields of tropical medicine and global health. In December 2019, JICA signed a comprehensive partnership agreement with Nagasaki University to improve the quality of international collaborations, promote international contributions, and foster academic research and education for partner countries.
ある長崎大学の先生からお話を伺ったことがあるんですが、その熱帯医学でいう言葉に「The bench is in the bush」という言葉があるそうなんですが、まさにその JICA の技術協力に参画することで、それを身をもって知ることができた。つまり、現場に入ることというのがそして、一緒に汗をかいてですね働くということの価値というんですか、それを実感して、おられたというお話を伺って非常に感銘を受けたことを思い出します。そういったことを長崎大学さんと一緒にですね成し遂げていきたいということで JICA から継続して教員を派遣させていただいて、途上国の留学生、研修員、それから日本人の大学院してもですねの人材育成に微力でありますけれども貢献させていただいております。
今その長崎大学はプラネタリーヘルスというのですね言葉をスローガンにしてですね、その地球の健康ですね。でこれをその一つの国だとかですね一つのグループだとかそこだけが良ければいいというわけでやっぱりみんなで発展していかなくてはいけないということなんですね。例えば僕らがやってるマラリアなんかですと、薬を染み込ませた蚊帳をドンと供与してですね蚊帳のその薬が効かなくなってきたらどうやったらもう一回その染み込ませて使えるようにするかとかですねそれを現地の人とやるというだからやっぱりいわゆる草の根的なですねそういう根付くんですよね。ですからうちの場合には JICA からもう教授クラスの人がずっとこう来てですね特に留学生ですね留学生の人たちをきっちりその指導してその日本のいいところをですねその国に広げていっていた JICA との直接のそういう協力関係でさらにそれをもっと強化をしていきたいということを常に考えていると。
Testing devices that use the fluorescent lamp developed by the Institute of Tropical Medicine, which are lightweight and operate on batteries, have been adopted in developing countries where the power supply tends to be unstable. When the Ebola virus was spreading rapidly in countries such as Guinea, Liberia, and Sierra Leone, 8 of these devices were sent through JICA, along with 8,000 virus test kits.
我々としてできることは、ここは大学ですので、日本を含めてですねアジア、アフリカ、中南米という開発途上国の方々の人材を育成しておくということですね。アフリカのあるいはそのアジアからの留学生たちも本来ここに来た時はデング熱とか黄熱病とかそういうその現地でまだ流行している熱帯病の研究ということを目的にやってきたんですけども今はそれに加えてですねみんな新型コロナウイルスの研究をしています。診断とか治療とか予防の研究ですよね。基本的にみんな母国の研究機関日本で言えば感染研にあたるような機関から派遣されてきているのでもうダイレクトに国の新型コロナ対策にですね即戦力として活躍してくれるというふうに思っています。
Leveraging its collaborative assets at infectious disease stations worldwide, JICA established Prepare, a partnership for building resilience against public health emergencies through advanced research and education. Concrete activities at the Institute of Tropical Medicine at Nagasaki University related to this partnership began with cooperation in Rift Valley Provincial General Hospital in 1966. For 27 years, it also cooperated in infectious disease research with the Kenya Medical Research Institute, which was established in 1979. In addition, in Asia, JICA has combined grant aid for facility improvement with technical cooperation for human resource development and research. JICA supports the National Institute of Hygiene and Epidemiology in Vietnam and the Research Institute for Tropical Medicine in the Philippines. JICA has also dispatched specialists in COVID-19 measures to provide training in PCR testing.
The system that I have seen here, especially in the Institute of Tropical Medicine, Nagasaki University, is something to learn from. The professors and the students work together, and we get a lot of support from the professors. I would be able to go back home and do the same with the upcoming young scientists and students.
When I go back, I think also train other colleagues and be in touch with Nagasaki University so that we can collaborate in research, even for Zika, yellow fever. We can collaborate.
You know, we are in an era of emerging and re-emerging infections. You see, like there was Zika in 2016, Ebola, now there is SARS coronavirus. So I can say that we really need to do a lot of preparedness in fighting against these bugs, which are a threat to our security. So I can say that this lab has been very fundamental in equipping us with a lot of great skills.
COVID-19 has devastated people's lives and societies around the world. JICA will take a holistic approach, focusing on prevention, precaution, and treatment. Using this approach, we hope to build more resilient societies that enable the protection of people's lives. First, prevention is key to stop COVID-19. We will focus on three important elements of prevention: clean water, hand hygiene, and proper nutrition. Second, JICA will also strengthen the precaution capacity of research institutions through skills development. It is vital to detect cases early to contain the spread of diseases. Lastly, JICA will further enhance its cooperation for medical services to provide all patients with proper treatment. We will collaborate to establish or upgrade hospitals that have integrated functions for treatment, research, and human resource development. We will also introduce remote medical services and will expand opportunities for medical staff to study abroad in Japan at the graduate level. Looking ahead, JICA will continue to work alongside our partners to protect people's lives around the world.